So I'll pass on to Lucas, and Lucas will give us some insights, some food for thought, what we then obviously can take up again in the discussion on federalism, intergovernmental conflicts, and or in between the relation with COVID-19 and how it was in Latin America. Obviously, Latin America is huge. You might pick some examples, I guess. Thank you, Lucas.
Thank you, Jean-Charles. Thank you, Elizabeth. It is a great pleasure to be in the global south, talking about some issues from the global south as well. By now we know, and sorry, I'm going to be focusing on Latin America, right? By now we know that the COVID crisis impacted all over the world, but the impact in countries is very different. I'll give you some data. The United States has almost 3 times the number of deaths per million than neighboring Canada. And these are very similar countries. I'm using the death rate, that is the number of deaths per million inhabitants. The United States has 4% of the global population, 18% of the COVID cases, and 50% of the global deaths. In Latin America, this also happened. Peru has the highest rate, one of the highest in the world, and it's 2 times higher than the second in the list, which is of course Brazil. And Peru is 3 times the neighboring the death rate in Peru is 3 times that of Ecuador, a neighboring country, also very similar in demographic and socioeconomic characteristics, and 4 times the figures of Bolivia. We saw these pictures and we wonder why. No, this is Manaus in Brazil. It's not a huge city as Sao Paulo, but we saw massive burials, and in many other places we didn't see that. So the big question that I'm trying to ask is, well, apart from those epidemiologic, demographic, and socioeconomic factors, we got some evidence on that. Are there any political decisions that affected these kind of outcomes? And if we briefly pay attention to the literature, the first line of studies underscore the role of democratic versus authoritarian governments. Now, when you have an authoritarian government, you can take decisions very quickly, you can impose them, and you can stick to them without all the restrictions we heard before. But on the other side, you also need legitimacy and some population support. So I gather data from Polity4 and VDEM. There is no statistical significance between the 2 types of regimes. So be sure we don't need an authoritarian government, as far as the data shows, to control a pandemic crisis. What about democracies? Well, the first idea was that more established, with better bureaucracies, more check and balances will do better. Well, that is neither the case. So big part of the project was to show that many expectations were not holding, right? Ideology. Well, the big idea was that leftist government would take care of workers and impose restrictions, even though you affect the economy. While right-leaning governments will tend to protect big businesses, being more soft on restrictions, especially for circulation. Yes, there is an evidence. The data is showing that leftist governments tend to have fewer cases, and when you have a right-leaning government in a very polarized system, you have the highest rate. But still, for instance, Argentina have a left-leaning government. At the beginning did very well, and then very bad. So even though there is a pattern, I'm not sure this pattern can explain fully, for sure, all the differences among cases. So these factors do not seem to be enough. And as I work on this and we have been discussing, I wanted to pay attention to the institutional features of federalism because, well, there are enormous challenges for coordination. Also, public health is usually a shared responsibility, and in many developing or underdeveloped countries, institutions do not fully regulate how health works. There are many ad hoc political decisions taken. But I also wanted to look at, and we have been discussing this, but I also wanted to look at whether federal systems being prone to cooperation, very strong cooperation or conflict, can have different outcomes. So inside the formal structure, whether conflicts among levels of government, because you have autonomy, would affect the outcomes. I can skip this to be very... I took a very simple definition, the Dalian definition about federalism, but I especially pay more attention to cooperation or conflict, and for that I constructed two indices. I can show you how we constructed them, but with a group of researchers. We collected data basically from 23 countries in Latin America during the first year of the pandemic, and 3 journals for each country. We collected data whether there was collaboration in detecting, in controlling, in seeking, tracing cases, in delivering vaccines, among levels of government and among levels of government and civil society organizations. And we also gathered data on whether in a given month there were conflicts between levels of government, especially between governors or mayors and the president. And then we got into some key cases that I hope I can have some time to talk about them. I'm not sure we'll see much, but this is the 2 indices. The first one is the Intergovernmental Collaboration Index, and you see Argentina is first. There are 16 dimensions, and Argentina has a score of 14. So there was collaboration in several aspects, and collaboration was sustained over time and regularly. And Brazil is very low, is actually the 5th from the cases with the least collaboration. And in terms of social collaboration, Argentina is third to Bolivia and Honduras, and Brazil scores very low as well in this dimension. I can get into some details of this later on, but having the data, what I wanted to do is, well, let's see if the results are statistically different. Well, first, formally, federal systems do not fare better or worse than unitary system. If you take the basic institutional feature, there is no statistical difference between the death rate in both groups. But if you pay attention to cooperation, if there is cooperation or if there is conflict, there is a substantive difference. The difference is about the mean. The mean is 300 cases per million, and when there is cooperation, cases are very low, way lower, and there is a statistical difference between these 2 groups. And this is some basic regression analysis. I'm not going to have time to get into the details, but the 2 highlighted coefficients indicate that when you have, federalism again doesn't seem to play a role. There is no statistical significant effect on the number of deaths, neither collaboration, but there is an effect if there are conflicts. When you have conflicts in a given country, this country tends to have about 190 cases per million more than in cases where there was collaboration. And also the index of social collaboration shows some statistical effect in the correct direction. Very quickly, how much time do we have, Elizabeth? 4 minutes. 4? Okay. Well, you surely know about this guy. He basically said this was a gripezinha, it's a little flu, nothing is going to happen. He not only denied, but he underscored the role of the pandemic. And I'm going to be pinpointed with the case of Argentina. The president in Argentina did the opposite. He was he actually several journals criticized him because he was overreacting to the pandemic. Bolsonaro opposed the measures proposed by WHO, while Argentina tried to follow them. Governors conflicted with the president in Brazil, and in fact, some of the arguments favoring federal system to deal with the pandemic had to do with what Brazil did. Governors in Brazil could resist the decisions from the president not to do anything. So they were much more active than the federal government and conflicted openly, not only governors but also mayors of big cities. And Bolsonaro had problems and conflicts in the federal Congress. Some laws were passed and he vetoed them. In the Supreme Court, with social organization, they work in parallel and sometimes in opposition. And inside the cabinet, the case of the health minister is very well known. He fired him because he supported measures taken by WHO. So these contradictory measures between levels of government generated confusion in the population and delegitimation of the policies. Competition for supplies and ended up in a sanitary collapse. While the case of Argentina, very quickly, the president reactivated the Federal Health Council, which was there but not actually functioning, and coordinated imposing restrictions, deciding how to allocate health aid, and a program to individuals and families. And very importantly, the president collaborated with mayors and governors, but also with unions and social organizations in the territory. So I'm going to skip this part, and also the case of Uruguay. I can talk about this unitary case, but wrapping up, it's not only about the institutional structure. The main finding, I think, out of the discussion is that it's not about the formal institution. It's about the political dynamics that occur inside or within the federal structure. If there is collaboration, the number of deaths tended to be lower. When there was conflicts between levels of government, deaths tended to augment. And collaboration was not only important with governors, but also with mayors and with social organizations in the territory. So I think, and also the sanitary collapse occurred when the president conflicted and denied the relevance of this, generated contradictory measures, misinformation, confusion, and competition for resources. Why? Why there was collaboration and why there was conflict in some cases? I don't know. One guess could be, since leftist governments tend to have better results, combining the two features could be that leftist governments tend to be more prone for consensual politics, probably, or supportive of lower income sectors. I think we need to think about it. Why there are different dynamics of collaboration and conflict within federal countries. And I think this has implications not only for health policies, but for policies in general. And I wanted to stress how important it is cooperation as opposed to conflicts in dealing with one of the global crises of the time. Thank you.
Thank you very much, Lucas. You terrifically managed to cover all Latin America and giving also insights on single countries. So now we have, as initially said, one paper more in this panel. It's my pleasure to welcome Rupak Chattopadhyay, and he will speak online and share his insights on intergovernmental coordination and federal dynamics in crises online.